Hi, I am Dr. Felice Gersh on a mini vacation here, and I am visiting my family in Utah. I'm here though because I want to tell you more about fasting and women, because you can never take a vacation from being healthy. But first, let me explain a little bit about who I am and what my mission is. I'm an integrative OBGYN. My practice is in Irvine, California. There I see patients every day doing all I can to optimize their health. I utilize a whole array of therapeutic tools, including mind-body medicine, nutraceuticals, supplements, nutrition, fitness, exercise, ways to reduce stress, improve sleep, relationships, and when needed, pharmaceuticals and surgery. So I am now doing my Instagram live series on fasting and women. And we've come a long ways. You've learned quite a bit. If you're new to this, you can go back. All of my shows are archived on my YouTube channel. Today, I want to explore a little bit more about the differences between men and women, because there are very dramatic differences, and our medical system, the researchers, have ignored women in so many different ways, and the differences between men and women in so many different aspects of health have really been sorely neglected. And this includes so many aspects concerning weight, nutrition, fasting, and eating disorders. So let's talk a little bit about underlying differences between males and females. Well, you probably don't need me to tell you that in females, the dominant hormone is estrogen in the form of estradiol during the reproductive years. And in men, of course, it is testosterone. Well, here's a fundamental difference you may never have heard about. Estradiol is an appetite suppressant. So many think that estrogen causes women to eat, causes women to gain weight, and it's actually exactly the opposite. Estradiol, which is what's made by ovaries, actually reduces the desire to eat. And it turns out that during the menstrual cycle, the time when women have the lowest appetite is at the time when they ovulate, which is when there is a spike of estradiol. That's when it's at its highest level. And they've shown in both humans and in animals that this is a time when appetite is lowest and food consumption is actually lowest in a natural sense. During the luteal phase of the menstrual cycle, when progesterone is produced, you also have naturally relatively high levels of estradiol. The appetite is actually more dysregulated in many women, and often they have PMS. So this is a problem that's related to an imbalance in the way that the brain is perceiving the hormones as well. It turns out that progesterone, which is a hormone that's more similar to testosterone than it is to estradiol, is an appetite enhancer. So during the luteal phase, women will, when they're not quite regulated, have more cravings and maybe binge eating. So progesterone promotes food intake and increases appetite, whereas estradiol decreases appetite. And what about testosterone? Testosterone increases appetite. Now, I'm sure you've all heard about those teenage boys when they start going through puberty and their testosterone level starts to just go through the roof. What do? They become ravenous. They can't stop eating. They're often hungry 5 minutes after they've eaten a full meal. Testosterone increases appetite, whereas, as I mentioned, estrogen does not. Now, this is a very interesting fact that I only recently learned, that in a time of food deficiency or deprivation of food, estradiol actually further lowers appetite. Now, this may have a role in certain eating disorders like anorexia, where in the beginning phases when they still make estrogen and they're having food deficiency because they're not eating enough and they're having food restriction, their appetite actually goes down. Now, perhaps we can look in the future at treating with progesterone because that increases appetite. If you look at women with polycystic ovary syndrome, PCOS, which is a condition I treat all the time, women in that situation have higher levels of testosterone. And by the way, it's not just testosterone. I should really clarify, it's all androgens. And androgens include other hormones that are of the type that are the male type, like androstenedione and the adrenal produced DEAS, dehydroepiandrosterone sulfate, which is also often elevated in women with PCOS. Now, many people take DHEA as an anti-aging supplement as they age, and that is an adrenal androgen, and it does promote appetite, but it also promotes the production of muscle. So that's, of course, why androgens, testosterone, DHEA sulfate, DHEA, are muscle enhancing. That's why males love it, and of course that's one of the reasons why it's restricted as and considered an illicit drug to use if you're an elite athlete, if you're a competitive athlete, because it's an unfair advantage if you take it because it can help to improve muscle production. Now, another important difference between males and females is that females have a significantly greater incidence of obesity. Women actually make up a very high percentage of those who have bariatric surgery. In fact, 80% of those who have bariatric surgery, which is the surgery like gastric bypass, gastric sleeve, these are the surgeries that are used on people who are substantially overweight, often with additional symptoms like diabetes and hypertension, other collateral disease states. And it turns out that females make up 80% of those who undergo bariatric surgery. Women have far more eating disorders than males, something like 7 times the incidence compared to males of having eating disorders like anorexia, like binge eating disorder, like purging, bulimia. So this is really significant to be aware of. So women are more prone to obesity, more prone to psychiatric illness as well. Women are more prone to eating disorders that, of course, can include restrictive eating. Now, where does this link to fasting? Well, we need to be aware of all of these things if we're going to utilize fasting in the most efficacious and safest ways. So, for women who are overweight, and this is now a substantial portion of the population, fasting regimens can be highly effective. And many women who have obesity or even overweight will also have other related medical conditions. Like I mentioned, insulin resistance, prediabetes. By the way, prediabetes is now considered a serious medical condition. It's not pre-problem. It's just a label. That means it hasn't progressed far enough to be labeled diabetes. But there are already many problems that are developing during the pre-diabetic stage, including you can get neuropathies, you can have renal damage, you can develop plaque in your arteries, cardiovascular disease. So pre-diabetes is a serious condition, often associated with overweight and obesity, as well, of course, full-blown diabetes and all the different forms of cardiovascular disease, from heart failure to atherosclerosis. So, and of course, renal disease as well. So we know that there are serious problems with weight and with other health-related issues in very large numbers of women. And in those women, fasting can be very beneficial. Now, there's some other things I would like to touch on, and we'll go into it in more detail in future programs. And that is the endocannabinoid system, which many of you know that people who have used marijuana, they often get what are called the munchies. And cannabis is known to increase appetite, and it's really related to the THC, which works as an analog of the endogenous endocannabinoid called anandamide. So that is very interesting, isn't it, that happens? Well, it turns out that there's a very, very intricate relationship between estradiol and progesterone and the endocannabinoid system. And there's a whole feedback system. As I said, we're going to go over this in much more detail in the future. But this is very, very important. So for people who start using cannabis, particularly in the form of marijuana, because hemp-based cannabis does not contain any substantial amounts, minuscule amounts of THC. However, as we know, many types of marijuana are now grown to increase the percentage of THC to maximize the psychogenic effects, which is not what we're looking for at all. So in this case, we want you to be aware that if you use marijuana that has THC, you will probably have a significantly dysregulated appetite system, and it can actually affect your production of estrogen. So we now know that it can potentially affect how the hormones are produced and dysregulate the menstrual cycle. The menstrual cycle is very important in reproductive aged women to having proper appetite control, and this is not appreciated. During the menstrual cycle, there are variations in intake of food depending on the levels of estradiol produced and the presence of progesterone. This is a finely tuned system, and this is what we call homeostatic food regulation or intake. There's another type of food intake that is now really rampant and highly dysregulated. It's called hedonic food controlled intake. This is based on nothing about health, nothing about the body's need. It's based on psychological programming by food that reaches what we call the bliss point, food that has been designed to create addiction, food addictions. So even though you're not hungry, certain foods just won't let you stop eating them. So knowing this, knowing that there's this hedonic food control that can override the healthy homeostatic food control mechanisms that are very intricately and very ingrained into our genetics and based on our hormones and, like I mentioned, and genetics. This is now a huge problem. People are eating manufactured foods that are designed to actually override the healthy mechanisms that our bodies are born with to control appetite. We must avoid those foods like the plague because they can really sabotage any eating program, any healthy program that you get on if you indulge in hedonic eating and have those kinds of foods around. So it's really important to understand that in females, the menstrual cycle naturally regulates food intake when you take out the hedonic food stimuli, when you eat proper foods. Now, in addition, the circadian rhythm is really intricately involved in food regulation. And now, so many of us live a life of circadian rhythm dysfunction. This is really a critical problem now. People are exposed to too much light, particularly blue light at night, which has a huge impact on damaging the circadian rhythms. People are often staying up way too late and not going to bed at an optimal time, which should be between 10 and 11 o'clock at night, and getting approximately 7 to 8 hours of sleep, a maximum of 9 and a minimum of 6.5 hours of sleep. The other thing is dysregulated food intake timing. This will also dysregulate the circadian rhythm, and this is really very important to be aware of. There's now such a trend to skipping breakfast. This is really a bad habit. I'd like you to realize that your clock is set by light, but also by nutrient sensors. So what you need to do to get back on track and to have proper regulation of your appetite is to get up in the morning at the proper time, hopefully the same time every morning, with rare exceptions. Get bright light, either natural light, like here I am outside, although I'm under the lovely umbrella right now. Get bright light in the morning. If you can't get out in the sunlight or it's still dark because of the time of year, get a light box. Get 10,000 lux exposure for about 30 minutes in the morning. Also repeat at noontime. At night, make sure your room is very dark. Start dimming the lights and avoid screens, computers, cell phones, and television for a minimum of 1 hour, preferably 3 hours before you go to sleep. If you can't, make sure you get amber blue light blocking glasses. It's not the same as no exposure, but it's better than optimal, well, I should say it's better than massive exposure. So these are some of the things that you can do. Now, how does this relate to fasting? It's fascinating, but it does. It turns out that there are certain enzymes in our body that link to the master clock in the brain and are influenced heavily by estradiol. These enzymes are called the Sirtuins. These are histone deacetylase enzymes. What they do is they modify proteins that have already been made. We call this post-translational modification. It's after the proteins are made. And the Sirtuins, they come in 7 varieties. The type 1, Sirt1, is the one that has been well studied, involved in many metabolic issues. Sirt3 is involved in mitochondrial function. Estradiol, the estrogen made by the ovaries, has a role in sirtuin function. It's bidirectional. There's a link, a beautiful link and connectivity between the sirtuins and estradiol. When you fast, you increase the production of the sirtuins. The sirtuins have a coenzyme called NAD. Many of you have heard of NAD, and some people are using it as a supplement and an IV treatment. Now, I am not really using that. I am not recommending that at this time. There may be a role for it. But what I can tell you is that if you live the right life with the proper circadian rhythm, if you go to bed at the right time, you eat at the right time, and we've talked about this. It means you have a big breakfast, and for most people, what I would say is eat a big breakfast, a medium lunch, and a small early dinner, and no snacking, and make sure you have a minimum of 13 hours from dinner to breakfast, and breakfast should be eaten within 2 hours of awakening. That would be optimal. So you can also do, if you're really, really anxious to lose weight and get your health back if you have metabolic dysfunctions, but please do consult with your physician. You can do more radical fasting during the day, where you eat 2/3 of your calories for breakfast and 1/3 for a late lunch, and stop eating at 3 p.m. And like I said, that's more radical. There is published data to support that, and that will also help get your circadian rhythm back, because most of us live a life of jet lag, which we're going to talk more about menopause and specifics with fasting in another program. But what I can tell you right now is that women in menopause who are not on any hormone therapy will basically be living the rest of their lives in a state of some degree of jet lag, which actually increases everything bad you can think of. And of course, a lot of those things are associated with aging. And they're not just about aging. They're about circadian rhythm dysfunction and lack of adequate hormones. So, fasting increases the production of these amazing enzymes, the sirtuins. Sirtuins have tremendous data in longevity in terms of expanded life expectancy in mice, in certain types of worms, and in algae. So we know that you can extend life in those more lower level creatures when you do fasting, and it's done through the mechanism of increasing the sirtuins. In order for females to have proper functioning of the sirtuins, they need to have proper amounts of estradiol. So this then leads into timing for when you would want to do fasting and how it's going to affect the menstrual cycle itself. Females are designed for successful reproduction. If there is inadequate food and the body perceives that it's chronic, the body will shut down fertility, and that means shutting down ovulation. And if it's severe enough, it will be shutting down the production of all ovarian hormones, including estrogen and progesterone. Testosterone would continue to some degree. So here's the story. When women fast, they need to be aware of their estrogen. They need to be aware of the timing of their menstrual cycle, and be aware that it's really important to get optimal benefits from fasting. You need to have a proper circadian rhythm. You need to have those sirtuins, those magical sirtuins. Now, NAD I mentioned just in passing. NAD requires the presence of niacin to be made. So make sure you get enough B vitamins. And if you're not sure, please take a nice B complex. Almost everyone will benefit from taking a B complex, and that will help you to make the NAD that you need. It comes from niacin through nicotinamide, and then it goes into making NAD. So, but you don't have enough niacin, you're not going to make it. So just get a B complex and eat, of course, all the healthy foods that we've talked about. So we've talked a little bit in the past about timing in the menstrual cycle. So in order not to suppress or alter the ovulation or the spike of estrogen, it's best for women to do their fasting for a limited number of days. Like I've mentioned, I like the fasting mimicking diet, Prolon, and I am a speaker for the company that produces it, El Nutra. But you can also do shorter fasts with water. You can do 3 and 4 day water fasts during the luteal phase. That's after ovulation and before the period starts, because that will not impact on the next cycle in terms of having proper ovulation. If you fast during the follicular phase, that's the time from the period starting until ovulation. If you are normal weight, you are unlikely to suppress ovulation, but you may alter the quality of the ovulation by altering the spike of LH and estradiol. If you fast during the follicular phase and you're underweight, you may stop ovulating altogether. When you fast during the luteal phase, you also can increase parasympathetic tone. That is part of the autonomic nervous system that helps you to be calmer and feel better. And because this all works together in this beautiful complex with sirtuins, the circadian rhythm, NAD, estrogen, the rhythm of the menstrual cycle, women who have PMS may find that they have fewer binge issues, they have fewer cravings, that they sleep better, that they feel better in general if they do some fasting during the luteal phase. They've done studies that fasting has helped people with very severe mental illness, such as schizophrenia. So we know that there's this reboot that occurs to the circadian rhythm and the gut microbiome when fasting occurs. So I know this is really complex. I want you to understand there are really innate differences between males and females, issues that have never been thoroughly and adequately explored. And I'm hoping that we'll get more research in the future looking at these amazing differences between males and females so that we can design programs that are tailored specifically to the time of life, to the hormonal status of women. And we're going to talk more in the future, not only about all of the issues with endocannabinoids and how that links to fasting and to estrogen and unique issues with females, but more about menopause. And is fasting going to be as effective in women who don't have any estrogen made by their ovaries in menopause? Well, more to come. We'll talk about that. So do what you need to do to get your life back on track, to get healthy. Sometimes you need to take a little vacation, even if it's a staycation. Take care of yourself, and you will get through this pandemic. We're going to learn much more about fasting and how it can affect you, your immune system, and help you to optimize your health and happiness. So take care. Have a wonderful day. Wonderful seeing you. Bye.